Hypothyroidism, Things You Should Know, Questions and Answers, Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Hypothyroidism, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of hypothyroidism. Chapter 1. 1. What is hypo? Hypo is low. 2. What is hypothyroidism? Hypothyroidism is a low production of thyroid hormones. 3. Hypothyroidism can also be called Hypothyroidism can also be called underactive thyroid. 4. Can hypothyroidism affect anyone? Yes, hypothyroidism can affect anyone. 5. What is the main function of the thyroid gland? The main function of the thyroid gland is to control the metabolism. 6. What is the effect of hypothyroidism on the metabolism? Hypothyroidism slows down the metabolism. 7. What is metabolism? Metabolism is the way the body transforms food into energy. 8. Is hypothyroidism a common condition? Yes, hypothyroidism is a common condition. 9. What is congenital hypothyroidism? Congenital hypothyroidism is when someone is born with hypothyroidism. 10. What is subclinical hypothyroidism? Subclinical hypothyroidism is an early and mild form of hypothyroidism. Chapter 2. 1. Is hypothyroidism more common in men or women? Hypothyroidism is more common in women than men. 2. Name 2 hormones produced by the thyroid. The thyroid produces triiodothyronine, T3 hormone, and thyroxine, T4 hormone. 3. What are the causes of hypothyroidism? Hypothyroidism is caused by insufficient iodine intake, Hashimoto's disease, thyroiditis, postpartum thyroiditis, thyroidectomy, etc. 4. What is Hashimoto's disease? Hashimoto's disease is an autoimmune disease that causes hypothyroidism. 5. What is thyroiditis? Thyroiditis is the inflammation of the thyroid gland. 6. What is postpartum thyroiditis? Postpartum thyroiditis is thyroiditis after the delivery of a baby. 7. What is thyroidectomy? Thyroidectomy is the surgical removal of the thyroid. 8. What are the main signs and symptoms of hypothyroidism? The main signs and symptoms of hypothyroidism are fatigue, weight gain, constipation, dry skin, heavy menstrual periods, difficulty tolerating cold temperature, muscle weakness, drooping eyelids, numbness in hands, and joint pain. 9. Do the signs and symptoms of hypothyroidism appear slowly? Yes, the signs and symptoms of hypothyroidism appear slowly. 10. Can hypothyroidism cause puffiness of the face? Yes, hypothyroidism can cause puffiness of the face. 11. Can hypothyroidism cause hoarseness? Yes, hypothyroidism can cause hoarseness. Chapter 3. 1. Can hypothyroidism lead to hearing loss? Yes, hypothyroidism can lead to hearing loss. 2. Can hypothyroidism lead to pregnancy complications? Yes, hypothyroidism can lead to pregnancy complications. 3. What are the pregnancy complications of hypothyroidism? Hypothyroidism during pregnancy can lead to high blood pressure, miscarriage, premature birth, etc. 4. Can hypothyroidism lead to breathing problems? Yes, hypothyroidism can lead to breathing problems. 5. Can hypothyroidism lead to cardiovascular issues? Yes, hypothyroidism can lead to cardiovascular issues. 6. Can hypothyroidism cause goiter? Yes, hypothyroidism can cause goiter. 7. What is goiter? Goiter is an abnormal enlargement of the thyroid gland. 8. Can hypothyroidism lead to infertility? Yes, hypothyroidism can lead to infertility. 9. Can hypothyroidism cause delay in puberty? Yes, hypothyroidism can cause delay in puberty. 10. Can hypothyroidism cause mental problems? Yes, hypothyroidism can cause mental problems. Chapter 4. 1. Can hypothyroidism cause high cholesterol? Yes, hypothyroidism can cause high cholesterol. 2. Is menopause a risk factor for hypothyroidism? Yes, menopause is a risk factor for hypothyroidism. 3. What is menopause? Menopause is the end of the menstrual cycle in a woman. 4. Can radiation therapy to the neck cause hypothyroidism? Yes, radiation therapy to the neck can cause hypothyroidism. 5. Can damage to the pituitary gland cause hypothyroidism? Yes, damage to the pituitary gland can cause hypothyroidism. 6. Could diabetes be a risk factor for hypothyroidism? Yes, diabetes could be a risk factor for hypothyroidism. 7. What is diabetes? Diabetes is a chronic disease that causes high glucose levels in the blood due to a lack of insulin in the body or insulin resistance. 8. Could multiple sclerosis be a risk factor for hypothyroidism? Yes, multiple sclerosis could be a risk factor for hypothyroidism. 9. What is multiple sclerosis? Multiple sclerosis is a chronic disease of the brain and the spinal cord. 10. Can rheumatoid arthritis be a risk factor for hypothyroidism? Yes, rheumatoid arthritis could be a risk factor for hypothyroidism. Chapter 5. 1. What is rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease that causes chronic inflammation of the joints. 2. Could celiac disease be a risk factor for hypothyroidism? Yes, celiac disease could be a risk factor for hypothyroidism. 3. What is celiac disease? Celiac disease is an autoimmune disease in relation to eating gluten. 4. Could Addison's disease be a risk factor for hypothyroidism? Yes, Addison's disease could be a risk factor for hypothyroidism. 5. What is Addison's disease? Addison's disease is adrenal insufficiency. 6. Could Down syndrome be a risk factor for hypothyroidism? Yes, Down syndrome could be a risk for hypothyroidism. 7. What is Down syndrome? Down syndrome is a genetic disorder due to an extra copy of chromosome 21. 8. Down syndrome is also called trisomy 21. 9. Could Turner syndrome be a risk factor for hypothyroidism? Yes, Turner syndrome could be a risk factor for hypothyroidism. 10. Is Sjogren syndrome a risk factor for hypothyroidism? Yes, Sjogren syndrome is a risk factor for hypothyroidism. Chapter 6. 1. What is Sjogren syndrome? Sjogren syndrome is an autoimmune disorder that causes dry eyes and dry mouth. 2. Is pernicious anemia a risk factor for hypothyroidism? Yes, pernicious anemia is a risk factor for hypothyroidism. 3. What is pernicious anemia? Pernicious anemia is vitamin B12 deficiency. 4. Is lupus a risk factor for hypothyroidism? Yes, lupus is a risk factor for hypothyroidism. 5. What is lupus? Lupus is an autoimmune disease whereby the body's immune system attacks its own tissues. 6. Is older age a risk factor for hypothyroidism? Yes, older age is a risk factor for hypothyroidism. 7. Is there prevention for hypothyroidism? No, there is no prevention for hypothyroidism. 8. How is hypothyroidism diagnosed? Hypothyroidism can be diagnosed by blood tests, thyroid ultrasound, etc. 9. Can hypothyroidism be treated? Yes, hypothyroidism can be treated. 10. How is hypothyroidism mainly treated? Hypothyroidism can be treated by medications that help to increase thyroid production. Chapter 7. 1. What foods are rich in iodine? Foods rich in iodine are dairy products, eggs, iodized salt, meat, etc. 2. What is myxedema? Myxedema cause very low thyroid levels. 3. Is myxedema a life-threatening condition? Yes, myxedema is a life-threatening condition. 4. Can myxedema cause anemia? Yes, myxedema can cause anemia. 5. What is anemia? Anemia is insufficient healthy red blood cells. 6. Red blood cells are also called? Red blood cells are also called erythrocytes. 7. Can myxedema cause heart failure? Yes, myxedema can cause heart failure. 8. What is heart failure? Heart failure is when the heart no longer pumps blood efficiently. 9. Can myxedema cause confusion? Yes, myxedema can cause confusion. 10. Can myxedema lead to coma? Yes, myxedema can lead to coma. 11. What is carpal tunnel syndrome? Carpal tunnel syndrome is a condition that causes numbness, tingling, and pain in the hand and arm. 12. Carpal tunnel syndrome is also called? Carpal tunnel syndrome is also called median nerve compression. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding hypothyroidism.